Welcome, welcome, welcome to the Black Woman Be Well podcast. I am your host, Jennifer Tomlinson, and you guys, I'm so pumped. I'm so excited because this is the very first episode of the podcast, and I'm so excited to have you guys listening. You have no idea. So, and you know what makes it even more special? It's not even just the first episode. It's also the first episode of a 3-part series we have dedicated to PCOS. So you guys are in for a treat. And if you don't know what it is, stick around. All the next 3 episodes are dedicated to it, so you'll learn about it. But if you stick around even longer, we have some really exciting topics coming up in the future. We are focused on talking about Black women and their unique health experiences. So we'll talk about relationships, mental health, stress, pregnancy, fertility, infertility, diet and exercise. I mean, we want to talk about all things that have to do with Black women and their wellness. So stick around. Thank you for joining us. And if you could take it even a step further, go ahead and like us and join us on social media. We have an Instagram account. You can follow us at Be Woman Be Well. Now that's just the letter B. So the letter B, woman, the letter B, well. We're on Facebook at Black Woman Be Well. You can like us there. And we have a website. So if you want to know more about the podcast and our guest speakers, you can visit us at blackwomanbewell.com. So let's talk about health. Joining us on this very first episode is a good friend of mine. I wish I could say colleague, but we didn't get to work together. She's just a really good friend. I want to take credit because
in the world of life.
She's just really good at what she does. Dr. Brittnie Fowler. Just really grateful and thankful that you're able to join us today to talk about the PCOS stuff and, the definition of it, the medical stuff, the stuff I can't answer. So welcome to the show, Dr. Fowler.
Oh, I thank you. So formal. Thank you for having me. And trusting me to be able to tell your listeners all about something that is near and dear to you.
She's used to me calling her Brittnie, so she's not used to me saying Dr. Fowler. But, for this, obviously, she gets the full credentials on the show.
So we're going to do that. All right.
All right. So for some of our viewers who are tuning in, trying to learn about this, we have to start from a foundational place. So, literally, what is PCOS? Could you explain the medical definition for our viewers, for our listeners?
Sure. So PCOS, that's the shorthand way of saying polycystic ovarian syndrome. And I guess the best way to explain it would be to look at each word by itself and then put them together. So when we think about polycystic, something that's a cyst is usually considered empty membranous cavity, right? That's usually filled with fluid. But when we're thinking about it in the sense of an ovary, it's actually not empty or fluid membrane, but more so immature follicles. And follicles is really a fancy way to say coating or wrap around an oocyte. And an oocyte is a fancy way to say a baby egg. And so what happens with PCOS is that individuals have both endocrine as well as gynecological symptoms. It's called a syndrome and not a disease because, one, we don't have one direct cause as to why people present with this, but also it's a constellation of symptoms. So these individuals can present in several ways, but generally speaking, the most common ways are things like hair loss and acne or excessive hair in other areas. That is PCOS if I'm giving a very basic medical definition.
It's a really good medical definition. While you were talking, I was sitting back.
Do you want a little bit more information on why we call it PCOS?
No, I think that was spot on. And as you were sharing, I even sat back and I was like, oh my God, I didn't remember that either. So even though I'm kind of curating this podcast because I have it, I forgot about some of it. So, as you were describing like the membrane and all that, I was like, oh, I didn't even realize that or think about that. So thank you for providing the medical definition. I would like to provide the way I would define it personally.
Sure. Sounds good.
PCOS is the devil.
Huh.
To me, it's a mysterious thing, and when you said it's a syndrome because it's a combination of different symptoms, different things, right?
Mm-hmm.
And for someone that has it, it's like this thing that's everything and yet nothing.
Right.
It's very mysterious to me, and it's something I could never really get a handle on. It almost felt like a ghost to me. It's just evasive. I couldn't figure out how to take care of it or solve it, or it's not, like you said, like it's not a disease that you treat or take a pill for. So for me, my personal definition, it's been an interesting journey to experience having it and trying to deal with the syndrome or the symptoms.
And to be honest with you, I think that's probably how a lot of people describe it.
Mm-hmm.
When we look at the history of individuals who are presenting with these symptoms, they don't go into their doctor and say, hey, doc, I think I have PCOS.
Exactly.
It's usually, hey, doc, I'm feeling depressed, or hey, doc, I'm having trouble losing weight. And oftentimes, if we as physicians aren't being mindful of what our patients are telling us, it can easily be missed. And so instead of, coming in one day and leaving with this diagnosis, it's several years of these various symptoms that can wax and wane. And before you know it, sometimes you feel like you're imagining things or you're just different, and you kind of start to accept that versus realizing that there are options for you. So it does make sense when you describe it as the devil, because it's this elusive thing. Some people believe it, some people don't.
That's so true. Let me ask you a question from a professional opinion. Do you think that it often does go misdiagnosed because people do come in wanting to address one symptom, not realizing that it might be PCOS, and so a medical doctor would focus on treating that one thing and not even realizing, that it could be PCOS. So do you think it's something that's oftentimes potentially misdiagnosed?
So I wouldn't say necessarily misdiagnosed, but I do think that overall there's this general unhappiness with our patients about how the disease manifested and how the medical world has been able to identify and treat it. And again, because people present so differently, it's not like someone who has Down syndrome. There's certain things that we know and we don't know, and that's how we're able to make a diagnosis. Or someone who has anemia, there's criteria that we use, and we say, yes, based on what I'm seeing on your labs, you have anemia. With PCOS, because there's so many different symptoms and it's kind of like you present in different ways, it becomes a little bit more difficult for someone to say absolutely on the first time seeing, I think this is you.
So with my own journey and own story with this, I think that there were some symptoms I experienced that I just thought were unique to me. So I just thought I could never lose weight. What I know now to be depression, at the time I didn't realize it was. Things like facial hair. I'm just a hairy person. I didn't realize it was all a collection of this syndrome until I was watching Oprah one day. And gotta love Oprah. Like, and I was, I always had like school activities to do after school, so I was never home to watch it. But this lucky day, it was, I was tuned in to Oprah, and she was talking. I don't know what she was talking about, but a person. There was a medical doctor there on the show, and a person talked about her symptoms, and it was like, oh my God, that's me. She talked about facial hair and having issues with weight. And so the doctor asked followed up questions like, do you have irregular periods and some other stuff? And I felt like every single symptom was spot on. Like, oh my God, that's me. So that was how I even heard of the acronym PCOS. And that actually prompted me to reach out to a doctor. At the time, I reached out to my gynecologist and talked about it. And so for even me, as an individual, I so willingly and so easily at a young age just took on the symptoms as, oh, this is me.
Right.
And didn't even know that I could ask a doctor about the symptoms in themselves. I was so easily able to just take on the symptoms and say, this is who I am. And I was just dealt a short, dealt a bad hand or whatever. And
again, you're not alone with the situation, because a lot of patients either don't feel comfortable advocating for themselves or don't even know that there's these possibly linked symptoms that they should talk to their provider about. Or if they do talk to their provider about it, sometimes provider may not really recognize it or pick it up the first time around. So there's multiple, it's kind of like the Swiss cheese model in the sense of various ways to fall through the cracks.
Very true. Can you give us some of the common symptoms for some of our listeners? What are some common symptoms of PCOS?
Sure. So I wish I could read this off like those people who do the auctions, but I'm going to take my time.
Wait, does that mean there's a lot?
Well, it's not exactly 2 symptoms, but maybe not enough to do the going once, going twice kind of thing.
Right.
Like we've talked about a little before, it's not every person presents the same. But generally speaking, when you're looking at a patient with PCOS, and if you want a little bit later, I can talk a bit about why the presentation happens the way it does.
Okay.
Kind of giving a bit of the pathophysiology. That'll be up to you. It's that excessive hair growth, usually on the places that we call, I guess the fans. What rating are your viewers? Are we trying to keep this G-rated, PG-rated, or?
I would say 16.
Friendly for all audiences?
We could do friendly in all, but this is I mean, we're talking about health here. Can we not be candid and just be honest?
I just got to ask these questions.
You're going to use the anatomical words though, right? Like.
Sure, if that's the way you want to go. But essentially, you're getting hair in places that sometimes you don't want to tell other people about. So maybe on your chest, on your belly, most common with a lot of women, it's also on their face. And kind of like you were saying, some people just think, well, I'm just a hairy person, when really it could be this presentation of what we call hairshoeism. Another thing is, so some people may get too much hair. Other people can get loss of hair. So it can be alopecia. So that's kind of like patches in different areas of the hair. And usually it's in a male baldness. You can't see my air quotes, but I'm air quoting on this side.
I did not know that was a symptom. I didn't know alopecia was a symptom. Wow. Okay. Sorry. That was fascinating to me.
So on one side, it can be too much hair. On the other side, it can be this male baldness pattern. Acne, but not your average acne that, you use I won't use a special brand because we don't want to advertise for one particular brand, but insert special brand of acne medication and things go away. This is to the point of having like scarring on your face and those kinds of things. That isn't really responsive to your run-of-the-mill acne treatment. For some people, it is the polycystic ovaries, and obviously you can't necessarily feel your ovaries, but this is usually something that's seen on imaging studies. And then other people can present with obesity, and other people can present because they're having these changes in their menstruation cycle. So either they're saying, I'm trying to get pregnant and I can't, or my cycle doesn't come as regularly as I think it should. So those are the most common symptoms. Some other people may not even know that that's a collage, and they may come in because they're talking to their doctor about having diabetes or changes in their cholesterol levels. And then the doctor can kind of backtrack and tick off the other things that are on the list and say, yeah, this sounds more like PCOS. Some people, again, can come in with depression or anxiety. Some people can come in with sleep apnea. And, again, you backtrack and kind of link the dots and say, yeah, this is as a result of your PCOS.
So I was trying to write down the symptoms you were going over, and I have 1, 2, 3, 4 out of 1, 2, 3, 4, 5, 6. So I got the full gambit there. The full Monty. So
which I'm sure you don't feel lucky about.
No, it's terrible. And that's why I was shocked at the loss of hair, because I have the opposite. Like, I just thought I was a hairy woman.
Right.
You know, and you said it, chest, belly, and face. All right. So all of the places where you were, could like have total low self-esteem about.
Exactly. Hence, a lot of people come in presenting with depression or anxiety because you may be overweight, and then you have this acne issue, and then on top of that, you're growing hair, and you're like, why am I growing hair in these places?
Right.
And so that affects your self-esteem. That kind of affects how you're interacting with other people. Enter depression and anxiety.
Depression and anxiety, which is another symptom I have. And then what was funny was the acne I did have, but it was in relationship to the hair, the facial hair. So I would have ingrown hairs because I don't think the hair was supposed to be there in the first place. So it grew curly. And then I also like had terrible acne bumps and stuff. So those went hand to hand. And then I've always had irregular menstrual cycles. I've never been regular. It's always been a mystery to me when it was going to come. And when it did come, it was always very heavy. And the sleep apnea, that was a new discovery this year that I found out that was a symptom, and actually ended up going to a cardiopulmonary doctor to kind of start that process. So those symptoms that you described, I have most of them. And what was interesting when after I watched Oprah, I talked to my doctor. She, at the time, I guess they were using the ultrasounds to diagnose it. And I don't know if it's changed, but at that time, I had to do a ultrasound of my, was it uterus? Or
generally
ovaries?
Because your ovaries are right by your uterus, so they're checking 2 for 1.
They had to check stuff, in other words.
Right. And the procedure can be pretty invasive.
Yes, very invasive, very uncomfortable. But I had to do that to get diagnosed because she said that there was like early signs of it, but it was early enough for me to do something about it. Like it wasn't full on like polyps or whatever.
Okay.
So could we talk about diagnosis then? Because that was my experience. And I've heard things have changed that that technique is not even really used that much anymore, if not at all. So what's the different ways someone can seek a diagnosis?
Well, first, go and talk to your doctor, whether that's your OBGYN or your primary care doctor. If for some reason you're already seeing an endocrinologist, that's the person you talk to. If you're talking to a psychiatrist, that's the person you can also talk to. Each of these individuals should be able to either refer you or help start your treatment process. In general, because of the nature of PCOS, and by that I mean, like we talked about, this constellation of symptoms, although PCOS is basically the most prevalent or most popular common endocrine disorder among childbearing women, we don't actually have a set or standard that the nation or the world in general follows. Some people go by the Rotterdam diagnosis, and that's basically these 3 criteria that are required, which includes polycystic ovaries on ultrasound. But there are others who decide that if you have significant changes in your hormone levels, then that's what we're going to go off of. Some people do it based off of physical symptoms. So like we talked about the obesity and then the hirsutism, as well as there's something else in which your skin starts to change. We call it nigrans acanthosis, and essentially that kind of is when your skin becomes velvety in certain areas, almost like a darkening of the skin, but the skin.
Did you say velvety?
Yeah.
Huh. This is different from hyperpigmentation?
So a part of the hyperpigmentation is in the diagnosis of the I'm sorry, I am stuttering on that word. Because when you're talking about hyperpigmentosis and you're talking about the nigrantosis, that's essentially what's going on. There's hyperpigmentation there.
Gotcha.
Yeah.
So if I'm understanding correctly, there's no set form of like a universal form of diagnosis. So a doctor could request an ultrasound. Another doctor might, or maybe like an endocrinologist might want to look at your blood test, like do a blood test to look at your hormone levels. And a different doctor might just kind of list the symptoms, and the collection of symptoms would prompt them to diagnose you with PCOS. Is that how you described it?
Well, basically, I'd say it this way: you present to your doctor. You and your doctor have this agreement that something's going on. Let's try and figure out what else is what. Try and figure out the reason that you're experiencing trouble losing weight, or having a change in your menstruation cycle, or having excess hair. Because we know that not everyone who has PCOS has the polycystic ovaries on imaging studies, then there is a certain population that can, if that was a part of the criteria that you had to have, then technically you wouldn't meet criteria, right?
Okay, yeah.
So the other thing is, okay, let's figure out why you're presenting the way you're presenting. And a part of that should be doing hormone tests to see if your FSH and your LH are within normal limits, to see if you have excessive levels of certain types of estrogen forms, or to see if something else is going on. So is one of a different hormone in your body like TSH, which deals with your thyroid. Is that under or over secreting, and that's why you're presenting the way you're presenting?
Right.
Or are you on a particular medication, and is that medication causing this change in your cycle pattern and your ability to lose weight? So it's kind of like a process of elimination, I would say, to be able to get to the diagnosis of PCOS. That makes sense. You have these constellation of symptoms. Let's figure out why you're presenting this way, and that's how we're going to come up with our diagnosis.
And it makes it harder, though, for the patient to kind of be empowered to know what to bring to somebody's attention, because of this process of elimination that you're describing. Like you kind of have to go through all these things, and it could be a million other things, right? Because there's so many different symptoms. So that's what makes it even more mysterious and hard to kind of wrap your mind around.
Right. So, well, I'm always for patients advocating for themselves. So if you feel like something's not right, talk to your doctor about it.
For sure.
I know oftentimes with our current society and how our sessions are going, we may feel like we don't have enough time in the session to talk about these things. But I always encourage, let's say you go to your doctor once a year, write down on a piece of paper the things that you've been noticing, so that when you get in, you don't get distracted. Yeah. And you're able to say, these are the things that have been bothering me. I'm noticing this. And while a part of it is advocating for yourself and talking to your doctor about what's concerning you, another part lies on the physician and their responsibility to be able to ask questions and check in and be naturally curious about what's going on with their patient.
Well, that's because you're a good doctor that you do that.
Yes. So part of it is, patients advocating for themselves, but also a part of it is a physician checking in and being mindful of what's going on and looking at the greater picture of a patient.
I think that self-advocacy message is so important, especially when you say write down your symptoms, write down your questions, because in the beginning when I was young and naive, it's exactly what you just described would happen. I'd walk in knowing what I wanted to ask, but, because the physician, they've been doing this, I'm like the 10th person that day, they're used to kind of the conversational part, and so they dominate it for a good 3-4 minutes, and they're talking so fast, like you said, you get distracted and you forget. And that wasn't a technique. I didn't use that until I got older, coming in with notes prepared to slow them down, and honestly to slow me down. Like, oh, wait, before you leave, here's this and that. I think another tip that's helpful is as you're being prescribed medication, keep a list somewhere with you. It's been really great with a phone to just keep that list on hand, so that if I am at the doctor's, I remember to say, oh, the other doctor prescribed this, or I'm also on this, because I would find myself in the room and they might ask me, and I'm like, I don't remember the name, I don't remember the dosage. And
we give you the look, like, for real?
For real? Or you leave, you're like on your way home, like, oh, I forgot to tell her the other doctor gave me this thing, So that self-advocacy is so important. So for those that are listening, the tip that Dr. Fowler just shared about coming in prepared with notes is so important, especially if you experience these symptoms and you want to talk about it. And then the other tip I would say is definitely keep track of the medications you're on to help inform those conversations. So you really helped us out with describing potential symptoms and diagnosis. So what about treatment? What are some common forms of treatment for PCOS right now?
So would you believe it if I said, just like PCOS can present in different ways and is kind of individualized, that treatment is also individualized?
Of course, because this is the Phantom Menace. This is the weird disease. It's not a straightforward situation.
No, but we got this. So the treatment does depend on the patient, the goals for the patient, but also keeping in mind essentially what happens when someone has PCOS long term, right? So we know that these individuals are at greater risk for having diabetes type 2 particularly. And I think some people may know that illness has the sugars, in which your glucose levels, aka sugar, hang out in the body for a long time. And that's not good, because the higher levels of sugar that you have in your system, the more damage you get to your organs, like your eyes, your kidneys, your sexual organs, keeping it G-rated. And so that's diabetes. But then you also have these other cardiovascular risks, so increased risk for heart attack, strokes, infertility, and then cancer as well, endometrial carcinoma to be specific.
Oh, wow.
So, yeah. When you're thinking about it, hormones are meant to be regulated, right? It's supposed to have an ebb and flow, have something that helps restrict it or allow it to flourish at one point in time. But essentially, as PCOS, we have to remember that there's this change in two primary glands in the brain that deal with our hormone regulation. And when we have this change in hormones, we have these symptoms, right? So obesity or increased androgen, which is kind of like a male hormone that females also have in their bodies. And in long term, these are the types of things that people can start suffering with. So when we're looking at goals, you have to think about risk and benefits for the patient and what they really want to do.
Okay.
So if I have a patient who's, closer to 40 and they're like, no, I'm not trying to have kids, we're good, then my route is going to be a little bit different than my patient who's 18 or 19 and like, I got my whole life ahead. I'm trying to get things done. So one of the first things we usually emphasize is what we call lifestyle modifications. And that's the whole eat right, diet and exercise can help reduce weight and help you feel better. So that's one thing we'll talk about. The other thing that we talk about is someone who is worried about their acne or their hair loss or their excessive hair. We can look at laser therapy, or there are certain types of medications that at one point in time were used for blood pressure, but we also use them to help reduce the amount of androgens or the male hormones in the system to help reduce the acne and the growth of hair. There are oral contraceptives, aka birth control. Usually we use an estrogen-progesterone combination, And that's with the goal of helping, one, get your cycle back on track, but also to reduce that excessive amount of estrogen that can eventually lead to carcinomas. And then there's a whole other level of situations that we consider when someone's trying to get pregnant.
I just want to say I'm really glad that you're here, because there's no way I'd be able to articulate. Huh? There's no way I would have been able to articulate the sciencey part. That was
sciencey, yes.
So smart. And I'm telling you, like, this is something that I have, but as you're talking, it's like I'm reliving some things and I'm learning some new things, even though I felt like everything that I've gone through with it, I become like somewhat of not an expert, but knowledgeable about it. But you're breaking some stuff down for me. Like I didn't realize the cancer connection until you said it, which actually makes a lot of sense. And I love the way you discuss the treatment of being goal-oriented based on the individual in front of you, and then approaching it with lifestyle modifications. Because that was something I did not have the first 15 years I was dealing with this. For me, after I listened to Oprah, that episode changed my life. I
hope you wrote her a letter and thanked her.
Huh?
I hope you wrote her a letter and thanked her.
She gets enough letters. She's fine. She knows we all thank her. But when I went to my doctor and I said, I think I have this thing, we did the ultrasound. She's like, yeah, you have it. The only thing we ever talked about was birth control. And I think what you said was accurate. And I up until this point, I was a little agitated, but having you talk about the goal-oriented perspective actually is making me go back into that seat and remember the conversation. She's like, do you want to have kids? And I was young. I was like, no, also not sexually active. So like, that's not going to happen. So she's like, well, okay, we can use birth control to regulate your menstrual cycles. And because that was the only option the only option I received and the option I stuck with for so long, up until recently, when I realized there were other options, I was a little resentful that these new options weren't presented to me. But now I realized, based on what you were just explaining, it made sense for the diagnosis at the time, the treatment at the time, that, she asked me if I wanted to have kids, and I was like, no. And so birth control was a way to go to regulate my menstrual cycles. So you just opened my eyes.
And it doesn't mean that it can't change over time. It's okay for you to say today, this is my goal for the next 2 years, and then come back 2 years later, or even a month later, or even 6 months later, and say, hey, this was my original goal, but now this is what I'm focusing on. I think across the board, lifestyle modification should definitely be a part of it. Yeah. But then there's other aspects as well that you want to take into consideration.
I think whoever's listening now should really take heed to that advice, or to that note that your goals can change. I don't think I knew that when I was younger, and so I just took birth control forever. But it's not that my goals necessarily changed in itself either, but I definitely didn't want to stay on it. And because different symptoms arose from taking it. But it's really good to periodically ask, should I still be doing it this way? Or is there other options, and being okay with it? So I hope whoever's listening knows that it's okay to revisit where you're at with your physician, and if it's not broken, you can stay with it. But it's also totally that self-advocacy thing you were talking about. It's okay to also ask, are there other options, or is there other things I should be thinking about? So I want to share a little bit about what happened to me, because I spent a long time on birth control. Was doing fine on it. And the type of birth control was oral contraceptives. I was really responsible. I took my pill, pretty regularly, until I got into a very high-powered, stressful job. And all of a sudden I was forgetting to take the pills, and it threw me all out of whack.
Sounds about right.
Totally like messing up my cycle, and what I had at the time felt were mood changes. So I went back to my doctor, let them know that, I had changed jobs and it was affecting my my ability to take it regularly. So she said, well, we have some other options, that it's not an oral contraceptive. And so she prescribed NuvaRing for me. It did not do well for me and my body. The convenience of it was great, but I didn't like using it, to be honest with you. And, to each their own. That's not my thing, though. You know what I'm saying?
But it's important for you to know that.
Yes.
And be able to express it as well.
If y'all don't know what I'm talking about, you can Google NuvaRing and how to use it. And, there you go. I'm not going to get into details. But I didn't like how to use it. And then also... And I followed up with her about my symptoms, and she said, well, that's not necessarily connected to this particular particular contraceptive, but I swear I gained 20 pounds and I was depressed. I mean, total depression, had to go see a therapist, got prescribed on antidepressants. At the time, not linking it back to the NuvaRing. But that was when I woke up one morning, I was like, that was the only thing I changed in my life besides the job. Yes, that's stressful, but that was the only other factor that I changed. And I was like, I'm not ready for this. Like, I don't want to do this anymore. I don't want to be on birth control anymore. And I told myself I need to get a handle on this, because another thing I thought would solve birth control would help solve. I, for some reason, thought it would help with my facial hair.
Okay.
So that was like a myth I had. I thought it would help with the facial hair, and it never did, because I don't know. I'm not smart, I guess. So
I don't know if you're not smart, but if the idea is, hey, there's something wrong with my ovaries and I'm taking this medication that's supposed to be helping my ovaries, then wouldn't all the other issues go away as well?
Exactly. So I was a little naive. So I was sitting there and I was like, listen, the facial hair is not gone. I'm not sleeping well. I'm depressed. I've gained weight. I have all these things going on, and I'm using oral contraceptive, or at that time, the NuvaRing birth control, to try to fix all of it. And in my head, it just clicked like, it's not going to fix everything. Let me start to go to specialists and seeking out a doctor for each symptom. And I ended up creating my own village to kind of help support this one syndrome, because I realized I couldn't do it. I couldn't do it by myself, and I couldn't do it with just the one doctor and the birth control prescription. So I ended up going to a cardiopulmonary specialist. They did the whole, you mentioned like this could cause cardiovascular issues, right? In some people. So I got all that tested out. It was great on that. But, we had to test for the sleep apnea because I wasn't sleeping right. So I'm still waiting on those results. I went to an endocrinologist. You mentioned that this can sometimes lead to diabetes in some women. Is that how you said it? So I am not diabetic, thank God. I'm not even borderline. So that's great. But what's interesting is that there is a drug that is used for diabetics that they are now prescribing for women with PCOS that have issues with weight loss. And that's the metformin.
Yes, this is correct.
Yeah. So
a part of the illness when we think about PCOS is we call some syndromes we say that they have this two-hit factor. So there's these innate genetic characteristics that you have, and at some point in time, a second switch gets turned on, and the two work together to produce the symptoms that you experience.
Oh, okay.
So while a part of it is the hormones, another part is actually having this sensitivity, or your insulin levels are high, but you're not able to get glucose into the cells. And that's what kind of leads to the hypersensitivity. And of course, if you're not getting glucose into your cells, that along the line can increase the risk of obesity. And then when we're looking at obesity can turn around and increase the amounts of hormones that you're having in your body. And then it kind of just continues that cycle of PCOS. So with the metformin, you're targeting that insulin hypersensitivity, essentially. And that's how it's helping with weight loss.
Wow,
and
okay.
maintaining your sugar levels at an appropriate level.
Okay. Very, very complex stuff. And when I was prescribed,
that's why science is awesome.
I know, right? And I remember like feeling like, I'm not diabetic. Why are you prescribing me this thing?
Right.
And and it makes sense now. So I got a cardiopulmonary specialist, endocrinologist, and a new primary care physician. And then the primary care physician was vital because she was the one that provided all the referrals. So that was she was very helpful in that way. And then the facial hair, I realized birth control ain't gonna get rid of it. So I got a little laser hair removal done. I wish I had done it sooner. It's expensive.
It is, but in general, I think most people respond well to it unless they have some certain sensitivity.
Girl.
Yeah.
I wish I had done it
Life
earlier. And then the acne went away because I don't have any more ingrown hairs and stuff.
So you got a 2-for-1.
2-for-1. Right? It's like awesome.
Yeah.
And then like now I go and get like, facials every month and stuff, and that there's different, things you can use for the hyperpigmentation and to level, even out your skin levels and all that. And so, but it literally took a village. I was trying
and again, when we're thinking about the idea of it being multiple symptoms, a lot of times that's the case.
Yeah. I was trying to do it by myself with a birth control pill. And for some that might work, right? That one thing might help for that person with some, like you said, other lifestyle modifications, possibly. But for me, I had to realize I got a lot of stuff that I'm trying to navigate on my own. And it took me a long time and a long time of learning the hard way to figure out I need to build my own life team to kind of help get a grasp on this mysterious phantom of a syndrome.
Right. And I suppose that's a part of why you're doing this podcast, to help other people realize the struggle, but also figure out next steps for themselves.
That's why you're so smart, Dr. Fowler.
I try.
Well, actually, that's all I have for you today. So this was a great segue to kind of wrap things up. And your medical knowledge, the internal database you have of information, it's pretty astounding. I appreciate you so much for offering the science and medical side to this as I kind of threaded my story throughout the conversation. And I hope that we help somebody today.
Hopefully, fingers crossed, right?
Yeah. Well, thank you for joining us. I really appreciate it.
No problem. And if you'd like, I can see about sending some resources to you for like advocacy and that kind of stuff for your listeners.
I think that would be great. Thank you so much for that.
Not a problem. Not a problem. Well, again, thanks for having me.
So please don't forget to stick around for episode 2. For that episode, I'm in the room with my best friend and my sister. We all have PCOS, so we get to talk about our diagnosis story. And for those that have PCOS, the whole diagnosis process can be difficult. And for those that are learning about it and you might have it, please listen in, because we have a lot of stuff that you don't have to learn the hard way if you listen to our stories. And then we also talk about birth control. And if you listen to the episode, you'll know why birth control is like a big part of the PCOS process. Please don't forget to like us on Facebook at our Black Woman Be Well page. You could also follow us on Instagram at Be Woman Be Well. That's the letter B, woman, letter B, well. If you want to email us, you can email us at contact@blackwomanbewell.com, where you can also visit us at our website, blackwomanbewell.com. Thanks again for listening, and see you for episode 2.